Hello, I'm Matthew Weinstock with Hospitals and Health Networks with continuing coverage of the Health Forum American Hospital Association Leadership Summit. I'm pleased to be joined right now by Jim Hinton, Chairman of the AHA and President and CEO of Presbyterian Health Services in Albuquerque, New Mexico, and Rich Umbdenstock, CEO and President of the AHA. Jim, Rich, thanks for being with me today.
Absolutely. Thank you.
So I wanted to talk to you guys a little bit about something we heard Monday morning from Malcolm Gladwell about the urgency to innovate. And as you look across the field, the hospital field, and you see the pressures of reduced reimbursement, the shift of value, but also this need to sort of redefine the H, Rich, as you've said, do you get a sense of urgency in the C-suite? And if so, how is that manifesting itself?
Well, I certainly do. I think we all know that change happens when the status quo becomes totally unrealistic, totally uncomfortable. And I think we are getting to that point as a field. Different markets, different individuals, different cultures getting there, not all at the same time, but definitely getting there. And people are starting to say, this world isn't going to go back to where it was. It's moving someplace different, and I need to be moving into that new world.
You know, it's interesting, while people talk about how much uncertainty there is in healthcare, I think there actually is more and more clarity. I think the signals that we're getting from payers, from regulators, they're all pretty clear that we have to be more reliable, we have to cost less, and we have to broaden our lens to take care of the needs of a broader population. I think all of that is creating a huge amount of urgency in health systems around America.
Jim, you mentioned that need to take care of broader populations. We spent the past few years talking about sort of the unit cost of care, so reducing supply chain costs or length of stay issues, quality, those types of things. And now we're talking about the total care, the total cost of care. So what kind of innovations are you guys seeing in the field in terms of getting your hands around that population health management and the total cost of care?
Well, I would say that the first challenge for the field is to define what we mean by population health. And it's a phrase that's thrown around everywhere you go, but it can mean a lot of different things, from a very attributed population that you have responsibility for through your health plan, maybe through an ACO or a capitated arrangement, all the way to your entire community, your entire state. And so I think what people are struggling with right now is primarily around definitions, and then determining where do you target, where can you make a difference, what are the highest opportunities, the greatest needs in your population. And there are great stories throughout our field of what health systems are doing.
You know, you mentioned also absolute cost. And I think a couple of real telltales that we're starting to see payers, primarily government payers, take a hard line and say, we're spending as much as we possibly can. We have to work out underneath that level and actually bring down that level, because healthcare is not affordable to the public structures. And frankly, it's not affordable to the average American when they have to walk up to their out-of-pocket costs. So what you're seeing in those cases are fixed global budgets. And that's when you start to worry about the population as a whole, because you've got to figure out how to balance the truly important, urgent, if not emergent, acute needs with preventive opportunities and unnecessary utilization, and move that out. But they're going to move those global budgets down over time.
And do you get a sense that that pain point is what's going to drive hospitals to fully understand where they need to go?
We've certainly seen it. We had a couple of visitors from the state of Maryland who are in a total revenue program come visit our board retreat in January. That's it. That's all they get to take care of the inpatient needs. Well, they've got to reserve that money for the patients who truly need it, so they've got to weed out the lesser acute, better treated on a community basis types of patients, and it happened to them overnight.
But here's the opportunity, is that the care is not going away in many cases. It's moving, it's changing from one location to another. And so health systems that can position themselves to go where the money is going are going to be the ones who are very successful in this new world. And many are doing it. And there's a lot of great examples out there that the field can look to.
You know, I remember from Jim's comment, I remember a lesson taught to me by Carl Bays, who ran something called American Hospital Supply Company that eventually was taken into Baxter. But we were peppering Carl. We were all young and wild and trying to stump the star. And we said, what about GPOs? What are you going to do? These people want to gang up and buy in volume. And he said one thing. He said, if that's how they want to buy, that's exactly how I want to sell. And that's the world that we're faced with. The public wants a different healthcare system. We can't fight that. We have to say, great, that's how we want to deliver.
Well, and Rich, that sort of leads into this next question that has also been a theme here at the summit of the disruptors who are coming into the healthcare environment. So whether it's your Apple and Google and other tech firms with the mHealth approach, or CVS, Walgreens, and others who are coming in, what kind of environment does that create for the hospital field, and how do you determine whether or not those are friend or foe?
Well, it's a fair question. It's one that a lot of health systems are struggling with. You know, I'm reminded that the largest retailer in the world doesn't have any stores. And so if Amazon is the largest retailer, what are the messages, what are the implications of that for hospitals that have these huge fixed cost investments? I don't think any of us see a world in which hospitals go away, but it is going to change dramatically. And these disruptors are sending an important message to the field. It's too complicated, there's too much hassle, it costs too much, it's on your terms, not mine. And I think that we have to listen to that and lean into it and not be afraid of that world. It's like online banking. You know, it's different. It's different not to go see a teller. I think most of us would say it's better.
Yeah, exactly. We're free to choose. We can view them as competitors and problems, or we can view them as new assets. But again, as soon as you have a fixed amount of money, you start looking for those more appropriate, less expensive alternatives.
And lastly for you guys, what do you think the role of the AHA is going to be in this environment, and how does the AHA as an organization need to evolve and pivot?
Well, AHA is always here to support its members. Every trade association exists for that reason. So our job is to help figure out what those early signals are and spread those signals to the rest of the field whose market may not be hearing it, or maybe for whatever reason individually they don't want to hear it. But to help deliver those messages and those early signals to people. And then it's to figure out how we can actually engage the group as a whole, as a collaborative, to learn from one another. We've certainly been able to do that, I think, very effectively these last handful of years around quality and safety improvement. But now it's operations, it's cost reduction, a lot of new population health, a lot of new challenges that we can try to help support.
People care about their health care, and there's no trade association better able to leverage that care and concern than the American Hospital Association. And so while the challenges seem insurmountable at times, I think the strength, the momentum, the tailwind, if you will, that the AHA has going into this new era is not to be underestimated.
Rich, Jim, I appreciate you taking some time to talk to me today.
Thank you.
Now, I'm Matthew Weinstock with H&HN. This concludes our coverage from the Health Forum AHA Leadership Summit. Thanks for tuning in.